I head the division of non-communicable diseases, and I'm also the principal investigator for the India Hypertension Control Initiative. Today is the World Hypertension Day, May 17th, celebrated globally. This particular day is primarily intended to bring attention and as well as an importance towards hypertension. And this particular day, where throughout the globe, the initiatives been happening to bring importance of measuring the blood pressure accurately, detecting the more people with hypertension and put them under treatment. So today's topic, which I wanted to really thank Indian Medical Association, Andhra Pradesh, for providing me this opportunity to discuss with you all on this particular topic, how to prevent thousands of cardiovascular deaths in the next 5 years. And when I say cardiovascular deaths, my focus is more clearly towards premature deaths. And why we need to talk about this particular cardiovascular deaths on World Hypertension Day. This particular graph, what you are all seeing, clearly shows that the total disease burden by cause across the world from 1990 to 2019. You could clearly see that in 1990, the majority of the disease burden was caused by communicable diseases, maternity, neonatal, and nutritional diseases. Over a period of time, in 2019, which is exactly closer to 30 years, you could see there is a drastic shift, a steady increase, or even I would say that there is an exponential increase of disease burden due to non-communicable diseases. And you can also see in the same slide, consistently, injuries burden remained the same throughout this past 30 years. There are multiple reasons for this. One may be there is a lot of intervention had happened on communicable diseases, maternal neonatal diseases, maternal neonatal health issues, and especially focusing on nutrition. This has steadily decreased over a period of time. But that is not the reason that we could say that it contributed more towards non-communicable diseases. But this is the called, what we classically say, epidemiological transition. This is not the case only for the globe. This particular graph is the disease burden, the same graph, but for India. You can clearly see that just a quick comparison that there is a very steady decline of burden due to communicable diseases, and it was very high during 1990. And over a period of time, you could see that the non-communicable diseases, its burden increased over a period of time. All these things are all in the measure of values. Similarly, study the injuries, the proportion remained the same. So why I am talking about, despite with all kind of non-communicable diseases, why I am talking more about cardiovascular diseases can be easily justified by seeing this graph. This graph, you can clearly see that nearly 20.5 million deaths every year are caused by cardiovascular diseases. This is the global causes of the death. And then comes cancer, then comes respiratory diseases, and then only HIV. Very classically, cardiovascular diseases burden is very, very high. And that particular cardiovascular disease burden, it actually amounts to 33% of all global deaths every year, which is 1/3. The most important problem here is that 75%, more than 75% of it, more than 3/4 of it, are occurring in low middle income countries. When I say cardiovascular deaths, again I wanted to emphasize that the deaths are predominantly premature deaths. This particular graph clearly shows that the death rate from cardiovascular diseases in 2019, it shows the annual number of deaths by country per 100,000 people. You can clearly see that Southeast Asian countries where maximum number of deaths, this is just a numerator only data, but the numbers are very alarming. So when you clearly see here that the number of people dying due to cardiovascular diseases per 100,000 people is very high among the Southeast Asian countries. And in this case, here in India, you can classically see that it ranges between some 500 to 1,000 deaths per 100,000 people every year, which means for a lakh population, there are nearly as low as 500 people are dying due to cardiovascular diseases. This number is very high. The same way, when I try to do that, the number of deaths by cause in 2019, you can clearly see that the nearly some 2.5 million people are dying every year due to cardiovascular diseases. And then comes respiratory diseases, and then comes cancers. When I say that 2.57 million, which is around some 25 lakh people dying every year due to cardiovascular diseases, then we need to dig more to find out the details. What are the important causes of these particular deaths? And that's why in in terms of DALYs, what are the leading causes of the death in India? You can classically see that ischemic heart disease amounts to nearly 14.3%, which ranked number one, which was in the fourth position in 1990. And there is again important factor which you need to classically see here is that diabetes. It was in 20th position in 1990, and now it is in the second in position, which is the leading causes of DALYs in 2016. And you can also classically see stroke is in the 10th place. When we try to dig deeper about what are the top risk of cardiovascular disease deaths, these are the important causes, the contributors to cardiovascular disease deaths, the important risk factors. The number one risk factor is raised blood pressure. This raised blood pressure, which is, you can classically see that nearly some more than 100 million people are dying due to raised blood pressure, especially the cardiovascular diseases. And then second important risk factor is air pollution. And then you have is elevated LDL cholesterol, and then tobacco use, and then high fasting plasma glucose, which is diabetes, and then high body mass index and low physical activity. This figure may be very surprising to many of us. We all may be thinking that diabetes is an important contributor for cardiovascular diseases. Yes, it is an important contributor, but it is not the number one contributor for that. The number one contributor is raised blood pressure. If I consider cardiovascular disease is a company, the majority cardiovascular disease death is a company, and the major shareholding is by raised blood pressure, which amounts more than to 50%. Then comes the air pollution, and then comes the high LDL cholesterol. Interestingly, if you observe this particular graph, that in India, majority of the people are always having at least three of these risk factors when they cross 40 years of age. So any individual, when crossing 40 years of age, then you may be surprising that the prevalence of such disease is very high. In India, the prevalence of hypertension is nearly 30%. And in India, we have a high risk of people getting exposed to air pollution. In India, there is a high salty diet and as well as high fat diet, which also leads to high LDL cholesterol. Tobacco use, though that is not much significant, the most important, the next risk is high fasting plasma glucose, which is diabetes. In India, overall, if you see that nearly 10% of adults are people with diabetes, whereas 30% of adults who are 18 years and above are people with hypertension. And the same way, when you clearly see here, the other important risk factor is high body mass index, which is obesity. What we observed in our national NCD monitoring surveys, nearly 34% of the adults are having obese. And naturally, with the current urbanization, with the rapid transportation, as well as with the more in terms of like a Western lifestyle, we have a very low physical activity. So you all must be agreeing now that India, any adult who crosses more than 30 years will carry at least three of these risk factors. Naturally, this all leads to premature deaths. This is alarming, and this is one of the biggest elephant in the room, which no one is trying to notice it. What I mentioned is not only just for adults from 18 years to across 69 years. When I investigate more, one of the important publications here that which clearly tells the latest publication what are the top 10 risk factors due to top 10 risk factors, the age standardized mortality rate for cardiovascular diseases 15 to 39 years. And again, you can clearly see that the number one is high systolic blood pressure. And then comes to high body mass index and then high LDL cholesterol. I'm requesting all of you to clearly notice here that all these are all important risk factor for young death, young premature deaths, very young deaths, 15 to 39 years. And that too, the three important classical factors are systolic blood pressure, body mass index, high LDL cholesterol. Apparently, we are all being driven by multiple lifestyle diseases, and we all think that all these diseases that we have can be compensated or corrected by lifestyle correction. But apparently, that evidence seems to be very, very low and it is challenging. As a public health measure, what all we need to target here is that any person with a disease who is either due to increased peripheral resistance or due to malformed heart activity or due to any kind of like an idiopathic cause, the person lands up into high systolic blood pressure, which is the most important sensitive indicator for premature cardiovascular death. So while we must be agreeing now that high blood pressure is the most important elephant in the room, where we really need to understand better. And it is not a rocket science. It's a very simple science and does not require high quality or very high expensive investigations. High blood pressure kills nearly as many people worldwide each year as all infections diseases are combined. And this is the most important deadly killer, and it is a silent killer. When it comes to India, that by applying the prevalence of disease over the population, especially adult population who are 18 years and above, India currently have nearly 20 crore people with high blood pressure. Please understand, 20 crore people. We have a population of nearly 120, 1.2 billion. And just try to do the math. Even though when we are trying to identify all these 20 crore, to be very honest, I wanted to say this that we don't have that much amount of like an manufacturing capacity in order to treat these 20 crore people. That is another important alarming factor which we all need to understand. And what happens to these 20 crore? How many of them are actually detected? How many of them are under treatment? How many of them are controlled? In the National NCD Monitoring Survey, on doing that, what we found is nearly 30%, which is 28.5% of people who are in the age group of 18 to 69 years are having hypertension. That is They are with the elevated blood pressure, who are having the blood pressure more than 140 and or more than 90, more than or equal to 140 or more than or equal to 90 millimeters of mercury. Assume that there are nearly 100 people with hypertension. Of these 100 people with hypertension, apparently only 28 are diagnosed. Please understand this is pre-COVID. This survey happened in 2017-18, which means more than 70% of people in the age group, people with hypertension in the age group of 18 to 69 years are undiagnosed. So imagine that, like, when we have 20 crore people with hypertension in India, then nearly 18 crore people are not diagnosed. Only 2 crore people are diagnosed. Just assuming that it is giving this particular math around that approximately. But what happened to these people? Overall, when you see that only 14 people are under treatment, and still this is having a huge disadvantage that more than nearly 85% of the people with the hypertension are not under treatment. And subsequently, that only 12% are under control. Most important point to note here is that, like, overall, when you see that nearly 90% of people with high blood pressure are not under control. And what do you expect to all these people? They land up into cardiovascular morbidity and mortality. Especially when I say mortality, it is premature death. You all may be wondering that premature death, which happens due to cardiovascular disease, may be of sudden onset, but we are all totally wrong. This is one publication which I wanted to highlight, published in 1963, taken from this particular book, Natural History of Human Atherosclerotic Lesion in Atherosclerosis and its Organ, Sandler and Bond. This clearly gives a schematic view of the development of atherosclerosis. Atherosclerosis development does not begin at 40 years. Actually, it starts as low as at the age of 10 years. You can clearly see in this particular figure that the atherosclerotic deposition started happening inside the lumen of an artery. The fibrous plate starts from a fatty streak and totally get calcified as a complicated lesion, which may lead to hemorrhage, ulceration, or thrombosis, which present as myocardial infarction, cerebral infarction, which is stroke, gangrene of the extremities as large level, and abdominal aortic aneurysm. And you all know that this development happens very clearly at the younger age group itself. I wanted to share with you all an important observation, what we have been doing it. The most important observation which we found that here is the calcification starts as low as even at the age of 30 years. And that's why you could see that, or you would have noticed that there were many young deaths happening even among the doctors, which means their calcification gets accelerated between the age of 20 to 30 years when they are carrying all other risk factors, the number one being high blood pressure. So this particular phases of the disease, all we should do is that we need to identify those people with at risk even at the younger age group as low as even at the adolescent. In terms of obesity, in terms of family history of heart attack, or in terms of like a family history of hypertension, and as well as current generation, younger generation are exposed to very high salty food and very high fat food. And that leads to a lot of metabolic changes, which leads to high LDL values, high blood sugar values, high BMI. Of course, as epidemiological transition, high blood pressure also coincides with that. All this risk leads to sudden cardiac arrest, even at the youngest age group, as low as 40 years. Of course, COVID is an important disease, which is an microthrombotic disease. microvasculature is affected in COVID-19. COVID-19 actually had increased the risk on those people with hypertension and diabetes. And thus, and after this COVID-19, which being one of the probable effect modifier, has made a drastic change in the increase of the risk among the people with uh, people who is at the younger age group, and they land up into premature death. Now let us just tell that, assume that there is a state of nearly 8 crore. And naturally, based on with the prevalence of 30%, we can assume that there are nearly 1.2 crore people with hypertension. Imagine if you treat that 1.2 crore people with hypertension. That is a number I am trying to tell. Very high number. And then what you can do is that in 5 years, you can prevent 75,000 deaths. The same if this number is very as much as low or the proportion is low, your number of deaths will increase. Think in a different direction. When I say that when you treat in 5 years, you can prevent 75,000 deaths. What if you don't treat or identify more people with hypertension and follow them up? Then naturally, 75,000 deaths will occur, and majority of these deaths are, or almost all are, premature deaths. The same happens in 10 years, nearly 1.5 lakh deaths can be prevented. And most importantly, in 5 years, 2.5 lakh heart attacks that we could prevent, myocardial infarction. So dear colleagues and friends, you can clearly see that in next 5 years, wherever you practice, if you just even count the numbers within your professional circle, you may be surprised to see that much amount of heart attacks, especially younger heart attacks, has been happening. But I wanted to compare this particular number here. For the current generic drug rates for hypertension, if you treat one patient 365 days correctly, all it costs is around 200 rupees per patient for the whole year. In Pradhan Mantri Ayushman Bharat scheme rate, PMJ scheme, for the same person when they land up into heart attack, we need to spend nearly 1 lakh. And we are not very much sure about their productivity, their vocational rehabilitation, and bringing back to their work. And it depends upon how quickly the heart attack was treated. Why we need to talk about this particular thing? Rather, we should talk more about the prevention aspect of it, which is hypertension, bringing the control of blood pressure. Control of blood pressure. This is one thing which we always need to talk everywhere. Control of blood pressure. Understanding all these things, we started this initiative called India Hypertension Control Initiative. This is a joint initiative which was started between Ministry of Health and Family Welfare, WHO Country Office for India, Resolve to Save Lives, which is our international partner, and all the state governments. We started this initiative in 2017. Eventually, with in 2017, we started in 5 states, in 25 districts. Now, IHCA is being implemented in 26 states. There is a change in number, 154 districts. And now currently, we have treated 54 lakh people with hypertension in primary care centers, health and wellness centers, community health centers, as well as in district hospital. How we did? We followed the 5 important strategies, plus another addition, which is the BP monitors. The key intervention strategies are introducing evidence-based protocols, introducing a team-based care and task sharing among the employees who are working in the centers, supply of protocol drugs uninterrupted so that adequate stock is available, and patient-centered care so that the patient is not going around in order to get treated and simply as closer to the home, and having a robust information system so that I can track the patient and also record the particular patient details. And I want to see the other details in terms of dashboard. And most importantly is provisional usage of professional blood pressure apparatus. I'm going to talk about 3 important things to all of you among these key intervention strategies. The number one is evidence-based protocol. This is an evidence-based protocol. One of the state is Tamil Nadu, where in Greater Chennai Corporation, we implemented this India Hypertension Control Initiative, and nearly some 1.5 lakh patients are continuously under monitoring so that they are coming under control, and nearly 60% of them are under control, which is a great number. This is a very simple protocol. Any individual who is 18 years and above with a high blood pressure, which means more than or equal to 140 or more than or equal to 90 millimeters of mercury, should be started with a amlodipine 5 milligram tablet once a day dose, preferably in the night before the sleep. After 30 days, on monitoring this particular patient, if the patient is not under control, then we need to increase to amlodipine 10 milligram. And the patient is controlled with amlodipine 10 milligram, then continue the same. If the patient is not controlled after 1 month, then the patient should get the telmisartan 40 milligram along with amlodipine 10 milligram. Clearly, you can see that the step goes either on two things. One is increasing the dosage of the existing drug or adding another drug. Maximum, this particular protocol says usage of 3 drugs, which is a calcium channel blocker, amlodipine, an angiotensin receptor blocker, telmisartan, and a diuretic, which is chlorthalidone. Based on our experience on nearly 40 lakh patient data analysis, we found that 70% of the patients are under control by just amlodipine 5 milligram. The second important part, which I wanted to talk all of you, is usage of professional blood pressure monitors. You all clearly know that elevated blood pressure can be diagnosed by only one technique, which is measuring their blood pressure using blood pressure monitors. And there is a cadre of blood pressure monitor called professional blood pressure monitor. Most of the marketed blood pressure monitors are not validated, but they are widely used in clinical settings. Mostly those are all domestic, smaller digital blood pressure apparatus. What I am talking is also a digital blood pressure apparatus, but they are called as professional because they have adopted at least any one of these 3 validation protocols, which is one is US Association of Advancement of Medical Instrumentation, or ISO. Number 2 is British Hypertension Society. Number 3 is European Society of Hypertension Working Group on Blood Pressure Monitoring, which is ESHIP. Any one of the validation protocol. But how do you know? You may ask that, how do I know that the blood pressure apparatus which I am currently using in a clinic is validated or not? Please go to this website, stridebp.org, BP monitors, and you can clearly see that because stridebp.org is maintained by European Society of Hypertension, International Society of Hypertension, and World Hypertension League. And this StrideBP blood pressure monitors, you can clearly see by category. There are certain office or hospital, which is professional. There is ambulatory, which is home. And there is ambulatory, which is home-based. Another is ambulatory blood pressure apparatus, children, blood pressure apparatus for children, and pregnant women. Of this, you could clearly see that there are certain blood pressure apparatus for diagnosis, which is of office or hospital. And here I wanted to clearly mention that currently in the market, we have many blood pressure apparatus, and there are certain cheaper ones and there are certain expensive ones, which are all professional blood pressure apparatus. You may also check with some of the 2-3 blood pressure apparatus. Some is that AMD 231, and another is Omron HBP 1320. This Omron HBP 1320 is also marketed at India, and AND 231T is also marketed in India. And these are all the professional grade blood pressure apparatus. Usually, professional grade blood pressure apparatus are costing around some 7,000 to nearly 20,000. And these are all only called as professional BP apparatus. And you may all wonder that why it is expensive, because they are validated by any one of these validation protocols, and they are more preferred for office use, which is the hospital use. Under India Hypertension Control Initiative, we supplied many professional blood pressure apparatus and we've been using this professional blood pressure apparatus in all our primary healthcare centers, district hospitals, and community health centers. Hypertension patients are large in number. Even in one of the primary health centers in urban primary health centers of Chennai, has as high as nearly some 2,500 patients are being registered. To track that much number of patients over a period of time, we used an open source free app called Simple. This app is free for everyone. Anyone can use it. You can also reach out to me if you wanted to use it at your setting. A patient is provided with a card called BP Passport card, which you can see in this picture right side. And that card contains a QR code. And this particular app is used in order to capture the patient information by scanning this QR code. On every visit, by just scanning the QR code, all the patient details could be obtained. And this particular simple app produces this kind of like a backend dashboards where we could monitor what is the proportion of patients who are under control. And you clearly see here that nearly 60% of patients are under control. And what is the registration by month and proportion of patients not controlled and who have missed their visits meeting the doctor for every at least 3 months. And this particular app has a feature where it will list all those patients who have missed the visits, and it has a feature to directly call the patient from the app, sends reminder messages also. So this is all about our India Hypertension Control Initiative, which aimed to save 1,000 lives across India. And this particular initiative, now we are planning to expand it to private sector. Currently, we have been implementing in all public sector primary healthcare clinics. To private sector, also we are thinking to expand it. And we support any facility, any organization, or any kind of like an hospital chain who wanted to use these strategies, and this produces very promising results and saves a lot of lives and the prevention care. For details of India Hypertension Control Initiative, using those materials, all are available free. You can check the website www.ihci.in. You can also reach out to me in this particular email ID. Thanks to Indian Medical Association Andhra Pradesh chapter by providing this fantastic opportunity to discuss with you all on this World Hypertension Day. And I expect that we all pledge to measure the blood pressure accurately, treat them, and continuously follow them so that we bring the control of hypertension at the earliest to save thousands of lives. I thank IMA Andhra Pradesh and I thank Dr. Simachalam who has provided this opportunity in order to meet all of you. Thank you.
Thank you, sir. Sir, am I audible, sir?
You are audible.
Yes, sir. Thank you for taking out your time, sir. Sir, as I missed some introduction and the earlier part, I would like to introduce you, sir. No.
Thank you. Please go ahead.
Yeah. Hello, everyone. I am Dr. L.V. Simachalam Kutikopala, the current state convener of IMA JDN Andhra Pradesh. My warm greetings to IMA National President Dr. R.V. Ashokan, sir, immediate past President Dr. Sharad Agrawal, sir, HSG Dr. Anil Kumar Naik, sir, and IMA JDN National Chairman Abul Hassan, sir, and IMA AP State President Dr. J.C. Naidu, sir, HSG AP State Dr. Fanidhar Polvarpu, sir, and IMA JDN AP Chairman Dr. Kiran Chitla, sir. Indian Medical Association is the largest representing voluntary organization of doctors of modern medicine of India. Every year, there are about 50,000 fresh medical graduates joining the medical profession with already existing 9 lakh practicing doctors in our country. So there is a need to engage, unite, and stand for the young medical graduates coming up. Hence, IMA has taken initiative to expand itself into a wing called IMA Junior Doctors Network, where the junior doctors below 35 years of age are represented, supported, and backed up. IMA JDN Andhra Pradesh is one of the active state branches of IMA JDN in the lines to support and stand for the young junior doctors of Andhra Pradesh. Today, as observance of World Hypertension Day on 17th May 2024, IMA JDN Andhra Pradesh is organizing this webinar to create and promote awareness on hypertension, which is a leading preventable risk factor for cardiovascular disease. So, hypertension related cardiovascular deaths affect an estimated people of over 1.3 billion worldwide, killing approximately 10 million people every year. So I take this privilege to thank Dr. Ganesh Kumar Parasuraman sir, who is the invited guest speaker for this webinar on how to save 1,000 cardiovascular disease deaths in 5 years. So Dr. Parasuraman sir is a public health researcher, field epidemiologist, and digital health enthusiast. He is currently working as Deputy Director and Scientist at Indian Council of Medical Research, ICMR, National Institute of Epidemiology, Chennai. He has been instrumental in public health program implementation and evaluation, wherein he has engaged with central and various state governments in doing so. Initiated and implemented hypertension control program across many states of India and was a key process evaluator of integrated management of neonatal and childhood illnesses IMNCA in 8 Indian states. He has also taken an active role in evaluation of diabetes and hypertension control program in 3 Indian states and post-implementation evaluation of rotavirus vaccination program in 4 Indian states. He has 23 funded research projects and 70 plus publications in various peer-reviewed journals to his name. He was also actively involved in pandemic and emergency response during COVID-19 pandemic in India. So I would like to express my sincere thanks to Dr. Parasuraman sir for sharing his expertise and insights on the hypertension, its related morbidity and mortality. Your presentation was not only informative, sir, but also thought-provoking. So I would also like to thank IMA and IMA JDN Nationals for their support and guidance. My heartfelt gratitude to Dr. Jason Naidu, sir, State President of IMA Andhra Pradesh, and Dr. Fanidhar Follower, sir, HSG IMA AP State, and Dr. Kiran Chitla, sir, Chairman IMA JDN AP, for their mentorship and guidance. We as IMA JDN Andhra Pradesh look forward to organizing more such events in the future and hope to continue this journey of learning and collaboration.
Thank you very much. Jai Hind.
Thanks.